Dr. Rob Davidson. Hi, may I call you Rob,
Oh,
Dr.
absolutely.
Davidson?
Yeah.
Anyway, very nice to meet you. I really appreciate your spending some time with us this afternoon to talk a little bit about the confirmation hearings of Robert F. Kennedy Jr. And before we do, I think a lot of people watching, can you all hear me? Someone said no sound. Okay, good. Um, I think that a lot of people don't necessarily understand, Rob, what a huge job Secretary of HHS is. Can you talk about that and what specifically it has oversight
Yeah.
of?
So, thanks for having me this afternoon. HHS, it's the kind of oversees the entire healthcare infrastructure of this country, including public health, the CDC, the NIH that, funds and works on and approves studies, basic research and more advanced research, helping then folks in academia further their research and development of drugs and vaccines and other
It
treatments.
oversees the Food and Drug Administration as well.
It does. So protecting our food supply, right? It oversees Medicaid and Medicare. CMS is a huge department under HHS. 80 million people in this country have Medicaid. We know that's potentially on the chopping block to give tax cuts to very wealthy people in this country. And so I think understanding, we know there's a lot of talk about vaccines, and we're going to talk about that, and we should. But it isn't just about his views on that. It's how he looks at the overall healthcare system in this country and what he's going to do to make sure that folks like me and my wife, who's a doctor, and my colleagues and our patients, what we can expect to make our jobs helping protect our patients and our communities easier.
And before we talk about some of the areas that RFK Jr. is problematic in, I think some of his messaging and some of his priorities resonate with a lot of Americans. I did a documentary in 2014 called Fed Up about, what we are feeding our kids in schools. It was really about the obesity epidemic, which, as you well know, has just skyrocketed and gotten out of control and is contributing is a comorbidity for so many other diseases. But some of what he is saying, and it's been coined the Maha movement or Make America Healthy Again. I imagine that, Rob, it resonates with you as a physician who sees the negative effects of obesity and maybe even the overprescription of drugs. And I'm just curious if how you feel about that and if it outweighs any of the other worrisome things that you're hearing.
Right. We agree that there is an epidemic of obesity and that health behaviors and basic lifestyle behaviors have a massive impact. 90% of healthcare outcomes have nothing to do with what happens in hospitals or in pharmacies or in doctor's offices. It has to do with just our lived environment. We have
The
food
so-called
deserts.
social determinants
Yeah.
of health.
And they are. The social determinants of health are, again, probably 90% of what drives health outcomes. Um, the built environment, food deserts, particularly in urban areas where people can't get healthy food or can't get it affordably, places where people can't go walk in open spaces, having an entire system that's built around automobiles and people driving, to the grocery store, driving to anywhere they need to go versus perhaps in other countries, certainly other times in this country where people walk more, people, their jobs were more
And
physical.
things like things like poverty, Rob,
Yeah,
that
it's such a driver. So we absolutely agree, and we would love to sit down with folks in this administration and whoever is at HHS and help us all work out how we can deal with things like poverty, like the built environment, like getting people more spaces where they can get out and move, and jobs that involve that, and improve our food supply. I mean, former First Lady, I think it was in 2014, maybe you talked to her about getting
I
healthier
did.
foods in schools for kids. And she was called a socialist by a huge segment of the population for trying to tell us what to feed our kids. And, now they're talking about the same things, getting rid of these unhealthy foods. And we absolutely agree. The problem is it isn't an either or proposition. Every time a patient comes into me or my wife is a family doc, we talk about these things with patients. We encourage people to make better choices, to have lifestyles that are going to support their health. Doctors go through their patients' medication lists every time they see them and look for places to eliminate. We know that it's called polypharmacy, over medicating, particularly in the elderly, is a real thing. And there's a massive movement, amongst physicians. I hear a lot that, oh, well, pharma is giving you all kickbacks, to prescribe these drugs. I will tell you, not a single doctor I've ever known or ever worked with makes money off of them prescribing drugs for people. They prescribe them because people have either diseases or symptoms for which they think they need them.
So we
And
both concede. So we
yeah,
both concede that these are two areas, and there are probably many others where the healthcare system needs to improve and chronic disease and obesity needs to be reduced. Having said that, there are many things that are quite concerning, and obviously 18,000 physicians, such as yourself, signed a petition urging the Senate not to confirm RFK Jr. Tell me the reasons those physicians signed that petition.
yeah, I think a big part certainly is his stance on vaccines. I mean, he has profited off of anti-vax rhetoric for years. And I heard it put a certain way recently that I didn't think about, but it's really adds to the cruelty, because beyond making, potentially making vaccines less accessible and seeing the resurgence of diseases like measles, like polio and others, he has seemed to have preyed on parents and families, particularly with kids with autism, and kind of leaned into the idea that the MMR vaccine was a cause of autism. That, Dr. Wakefield in England, who did the study with, I think, 12 patients, he admitted after the fact that he literally just made it up.
And that
It was
he was
completely made
being
up.
paid, and not only
Yeah,
that, he was being paid by some entity
yeah.
that had a vested interest
By,
in saying vaccines were
yeah.
bad.
By lawyers who were suing on behalf of these families. He admitted he was lying. Nearly everybody who was on the study with him completely retracted their names from anything associated. He lost his medical license. And yet, families are still desperate, looking for reasons why their child, who previously seemed healthy, all of a sudden has this horrible disease. And we don't know all the answers. We know there's maybe environmental, maybe something genetic. We don't have the answers or the cures. And so someone like him comes along who's very charismatic. I think his cousin said that about him for years, and gives them a reason, and then has seemingly profited by millions of dollars off of this particular rhetoric. It's dangerous, and it's really cruel that he's done that to these folks.
And I think it's interesting that we don't have to get into the whole MMR vaccine, but there's an excellent documentary on PBS called A Shot in the Arm about how the anti-vaccine movement gained momentum. And I guess some of the symptoms of autism surface or become, you become aware of them or become apparent at about 2 years of age.
Right.
And that's a short time, I guess 6 months after the final MMR shot. Is that
Yeah.
right?
Yeah. And it's when kids are supposed to be hitting certain developmental milestones that they just then aren't hitting. And so we that's when you see it develop. And yeah, but it's really sad. But right, it isn't just MMR. I mean, he's involved in a lawsuit against Gardasil, which is a vaccine that helps prevent cervical cancer. Literally helping prevent people from getting cancer, safe as can be, and yet he is questioning whether this should be
And
available and
there's
making
some
money off of it.
questions. Now, during the hearings, he has insisted that he is not anti-vaccine. He has said that his children were vaccinated, although he was later, uh, videotape shows him saying on more than one occasion, if he could turn back the clock, he wouldn't get his children vaccinated. But what do you make of his defense of his position and his insistence that he is not anti-vaccine?
I mean, to me and to others, it seems convenient that he is doing this at this time because he knows that he's at risk of not being confirmed. And a big reason, beyond his lack of understanding of what HHS does and Medicaid and Medicare, but this very issue of vaccines has resonated so strongly with so many people, and with, like you said, 18,000 plus physicians within our organization who have signed on. That it is untenable for him to maintain the views that he has espoused and profited off of for years and perhaps decades. It won't work. So he has to try to turn back time and pretend like none of that happened.
He also has been behind many conspiracy theories beyond vaccine misinformation that the coronavirus spared Jews and Chinese people, that antidepressants are linked to school shootings, that chemicals present in water sources are the root cause of people of I guess gender dysphoria. Tell me how you view some of those positions that he has taken in the past, and now, of course, says he doesn't believe those things.
He also questioned whether or not HIV causes AIDS. And still questions that and won't acknowledge that it does. What a slap in the face to those people. I remember in the 80s, I was old enough to remember AIDS being a death sentence, and now HIV, infection it's a chronic disease that can be managed because of research, because we determined what it was that caused it, and we now have ways to keep it at bay. I mean, it is so concerning. It's bad enough that he has a platform, right? He does. He started a company. He's convinced people to support him and to fund him. And it's a free country and free speech reigns true. And he should be able to do that as much as we wish he wouldn't. It's another thing to give him the megaphone of the US government, right? To give him the seal of the US government with which to spread these conspiracies that frankly can get people killed. Antidepressants aren't for everybody, but antidepressants, SSRIs, the kind he's talking about, have been truly, literally life-saving in conjunction with therapy and other kind of modalities, saving people's lives, And so because they happen to not be for everyone, but they are for a significant number of people, life-saving, if he's out there, spewing falsehoods that tell us they're dangerous for everybody, you're going to have a lot of people that are going to be questioning it and family members questioning it when it could work for them. That's terrifying to think that those people could be deprived because this guy is in charge of this agency that can put that out.
Right. And you also obviously worry about the impact his views will have on actual public policy. I know that Bernie Sanders asked him whether COVID vaccines were successful in saving millions of lives. Kennedy replied that he didn't know and that, quote, we don't have a good surveillance system. I still think there is a lot of confusion over the efficacy of the COVID vaccine. Can you address that for us?
Yeah. We know from population data, because that's how we study the impacts of big public health initiatives. You look at population data, you look at populations of people who have, undergone a certain treatment, or in this case, gotten a vaccine or a certain number of doses, and then other populations who haven't. And we have clear data that shows COVID infections, hospitalizations, and deaths are less in communities that have a higher uptake of the vaccine. It's incontrovertible. He maybe hasn't seen it because he hasn't sought it out, or he is just trying not to see it so he doesn't have to either lie about it or confirm that it is in fact true. We unfortunately saw this play out in a political way. People who are Republicans have a lower uptake. It's been shown convincingly, and have also in those communities had higher mortality due to COVID. I work in a place that is a very, very high percentage of folks who voted for the current president, where vaccine skepticism and COVID vaccine denial is very high. And it's so depressing to take care of somebody who didn't get vaccinated, or now vaccine rates for many vaccines, like the flu shot that people used to get, because it does help, right? It helps prevent hospitalization and death. People who don't get it and then come in extremely sick with these diseases. It's so depressing. But we soldier on, we treat these folks, and we try to correct their misbeliefs and try to hopefully kind of overcome what they've learned from folks like RFK Jr.
Elizabeth Warren gave him hell in the hearings, and I think she asked him about the lawsuit he's involved with the major vaccine manufacturer, Merck. Why is his continued involvement in this lawsuit significant?
I believe that's the one against Gardasil, the
yes. Well,
HPV
Merck does
vaccine. Yeah, the one that prevents cancer. Well, he profits off of every person he brings to this lawsuit, and any money they bring in, he apparently gets 10%. This is what she said. I believe that is probably true. He didn't refute that. So as in her example, I think she said, if $10 million comes out of this lawsuit, you get $1 million. Well, if he is now overseeing the agency that can put out information, that can put out misinformation about this vaccine, that can sway a jury, that can give, a prosecuting attorney or a litigant more fuel that is based not in reality, but just on his opinions or his thoughts or faulty data, that has the direct result of enriching him. I'm not sure many people could go into that and kind of set aside the concept of making $1 million, by putting out a few studies that aren't true, but that help support that notion.
Let's talk about your concerns about what this means in a practical sense. If he is confirmed and he holds many of these controversial, to say the least, if not misguided views, how it could impact public health in general.
Yeah, I think the vaccine thing, we just have to go there because that is so huge. I've been an emergency doc for 27 years almost now. I have never seen polio, never seen measles, but there's another one that I like to talk about that people don't think of, Haemophilus influenza. It causes meningitis, causes a disease called epiglottitis, a horrible infection in the throat in little kids, and kids died from this. It looks similar to croup. A lot of the viewers here have seen croup. I've had my own kid have croup. It sounds terrible. I've seen 1,000 cases probably. Croup is a very treatable viral illness. Give them a breathing treatment, give them some steroids. Most of them go home in a couple of hours. In the early days of my career, every kid who came in who looked like croup got x-rays because we were worried about this horrible disease, because it was only 10 years after the vaccine for Haemophilus came out. In the early days, kids would get admitted to the hospital. And before the vaccine, kids died from this disease. I've never seen it. I've never seen it. People, my contemporaries the same age as me, have never seen this disease because we got rid of it. We eradicated it. And as we see people not vaccinating their kids against these deadly diseases, we have seen outbreaks of measles. We see pertussis. We're currently involved in a little bit of a blip of pertussis in our community in West Michigan, and seeing kids coming in sick and getting admitted to the hospital and exposing other kids. Because even if you get your kid vaccinated or yourself, immunity isn't 100%.
Yes,
We depend upon
going
that.
to try. I was
Yeah,
going to get you
yeah.
actually next, Rob, to explain why if there lack of vaccine compliance in a community is so dangerous because of the need for herd
For
immunity.
sure. And as much as we'd like one vaccine for one person to be 100% preventative, it just isn't. And so, we call it the Swiss cheese defense. So you have little holes here and there, but if you put it all together, you're going to have a pretty good defense. And so if you have a community with a significant number of people not vaccinated, now measles kind of takes hold in that community. And the unvaccinated are at much higher risk. Those are the folks that are most likely going to get sick, and the kids that are going to really suffer. But the ones who are vaccinated, even 5% or 10% were to get the disease, that could be a significant number of people as you look at a population in this country of 300 and some million people. And so we really do depend upon everybody being vaccinated against these diseases that we thought we eradicated so many years ago, or they will continue to come back. And then if half the population gets vaccinated, that's great. We're still looking at half the population at risk and a certain percentage of that other half that's going to get sick eventually.
Let's talk about uh, uh, the things he said about abortion.
Mm.
I know that he has openly been an advocate of abortion rights for women, says that it's up to the woman to choose. But now he has said he basically, will support whatever President Trump wants to do. And the anti-abortion act advocates have recommended studying mifepristone, which is the abortion pill, and its impact on women's health. And they are doing it under the guise of we're concerned about the woman's health, even though it has been exhaustively researched and proven to be safe. What do you think his impact on access to this important pill for women? What do you think that will be?
Well, I think it's their way of getting around having to pass a national abortion ban, which so many Republicans want to do. And we're convinced that the president would sign. So if they can make this extremely safe and effective, again, exhaustively studied, extremely safe pill, more than I think 2/3, maybe up to 3/4 of abortions in this country are pill
Right.
abortions, medication abortions. And only 2 or 3% of those folks end up having to go to a doctor for some kind of a procedure versus 100% who would otherwise want an abortion. So an extremely safe treatment that's effective. If they take that away effectively, they are banning abortion, particularly in communities where, in states where it already has been banned, where that might be their only way to have access, or going to a clinic to get access. You're condemning women who would so choose to have an abortion for any number of reasons to having risky procedures that carry complications, to taking multiple days off of work and getting childcare and having to drive to clinics in different states potentially, or certainly even in different communities, and taking more time away from their family and their jobs. And in a society where we don't universally give people the right to take time to deal with their healthcare needs. So now you have people risking their jobs to do this. And in the end, you're going to end up having more women, carrying pregnancies that weren't intended, more kids potentially born into poverty, born into situations that aren't safe and healthy for those kids. I mean, I think the cascading impacts are kind of limitless. And I think it's terrifying to see someone who would be so malleable on such a critical issue, who will be in charge of that very important component of women's right to choose and right to access reproductive health care.
Another important thing is competence, obviously, and that's been called into question for a number of these cabinet nominees. And Senator Cassidy, who himself is a physician, and a Republican, questioned RFK Jr. about the way Medicare and Medicaid works. And he seemed to be unclear about those healthcare systems,
Yeah.
saying that people in Medicaid had premiums, and often usually there are no out-of-pocket expenses for Medicaid recipients. What did that tell you about his knowledge and understanding about the healthcare system writ large?
Yeah. So, Katie, I'm a doctor. I do medicine. I'm not a policy expert. I have a degree in medicine, a degree in public health, but not in policy. And I understand those basic tenets. And even if I didn't, if I was going before a Senate panel to talk about this job that I supposedly want and think I'm qualified for, I think I would learn just a basic about these plans. I mean, Medicaid is a lifeline. Expanded Medicaid has become a lifeline. 1 million people in my state of Michigan have that under the Affordable Care Act. And it is because we have the poorest among us. They have the ability to access healthcare, to get preventative healthcare, to go to the emergency room if they're having a heart attack or a stroke or need their appendix out, and not have to worry about going bankrupt and going further into medical debt. There are no premiums, there are copays. We have it set up that way for a reason, because these are people in poverty. These are people who can't afford those things, right? The private healthcare system needs to get better. It needs to lower premiums. He's right. We all believe that. We encourage them to continue the tax credits that help people afford healthcare, that have 20 million people with Affordable Care Act health insurance plans because they can't afford it. We hope they extend those. They're due to expire at the end of this year. We want them to make Medicare better. We think Medicare Advantage is a crisis in this country. It's allowing private insurance to essentially take over Medicare, making it more expensive for seniors, but also making it more expensive for the government. They are taking more out of the Medicare system, making it harder to manage Medicare for the rest of folks. And so he demonstrating his misunderstanding or lack of understanding, particularly to a physician like Cassidy, who's a Republican, I think is really important that we pay attention. I hope Dr. Cassidy was paying attention. I hope some of his colleagues were as well, because I think whatever you believe about his views on vaccines and whether you think they're okay or not, you should expect a certain level of understanding from a person who wants this job.
You read, I'm sure, or listened to Caroline Kennedy's letter about her cousin. Do you think that's going to have any impact? That really was about his character. And a friend of mine said, if it's about character, Donald Trump wouldn't have been elected. So do you think that really will have any impact on the confirmation process?
Yeah, I hope it does, because I think you're getting that firsthand account from someone who is extremely close to him over the years. I think what I heard was, and she talked about how charismatic he is, and I talked about that a little bit earlier, about how he can convince people of things that simply aren't true and can profit off of that. So I hope that by her saying this, some of the senators who who might be a little squishy, who might not be completely, if he doesn't get confirmed, it's not going to be 60-40. He might get confirmed 50-50 with a tiebreaker from the vice president, but he might not get confirmed with 51 or 52 senators in total voting against him. And I think if they can see through that facade, that very charismatic individual who has been able to convince a lot of people of things that just aren't true and that are frankly dangerous, hopefully that can help them get to that no vote. Whoever is appointed eventually, if it isn't RFK, I am sure that many of us will not agree with some of their positions, particularly on Medicaid and work requirements and Medicaid block grants and cutting Medicaid and further privatizing Medicare. We're not going to agree with that, and we're going to fight like hell to keep to keep those programs solid and make them stronger. But at least we can get someone who understands the system, who believes in basic science, who believes in public health, and hopefully those senators will see that, and that video will help them see that.
I think you answered this question, Rob, but before you go, one of my followers was asking, he said, oh, can RFK restrict access to vaccines if he is confirmed? And I guess there are all kinds of ways he can weaken or dilute vaccine requirements, right? Can you talk
Yeah.
about in his capacity, pragmatically what he could actually do?
Right. Through the FDA, they can certainly rescind patents, require, further testing beyond the exhaustive testing that has been done. They can change the immunization schedule, right? They can just take it out of the basis of basic research and what we know works and put it into something else that won't be as effective. But maybe the most important thing that, he said he won't do those things. Again, I don't know what is true with him. He also was pro-choice. He's no longer that,
Right.
apparently.
And he also said he didn't say a lot of the things
Yeah,
that he's on video saying.
yeah.
So,
But what he really can do, probably most damaging, is just put out there the doubt that he's put out there as a private citizen and as someone who runs the nonprofit that they run. He can do that with the full force of the U.S. government, right? With a government seal from the biggest, with the biggest megaphone you could imagine in public health. And he can appoint people that will align with that thinking and will have to toe the line. He said that about appointing people who are anti-abortion, who his deputies. He did say that. Well, with his deeply held beliefs about vaccines he's held for so long, you can bet that the people that are working under him and are the mouthpieces out into the communities are gonna at least espouse those views, whether they hold them or not. And that to me is really terrifying. That's where you get into the rooms with your patients who haven't been vaccinated, and it used to be they would trust their doctor because their doctor has been looking out for them and their family for decades, and now they're gonna look to this disinformation and have another channel to get it, and that's to me pretty terrifying.
I know that the next step is a vote by the Senate Finance Committee, which is likely to happen next week. Today's hearing was raucous, but apparently the Health Committee has no say about whether the nomination is forwarded to the Senate floor. What is your best guess, having watched, I'm sure you were dealing with patients too,
Yeah.
Rob, but as best you could, the confirmation hearings, do you think he will be confirmed?
I am hopeful that he will not be, and as a group of physicians, I think, and as kind of doctors across this country need to just continue to communicate so the senators can hear it, so their constituents hear it and can kind of push up. We have this letter you mentioned. We have an action center where we're asking physicians to call their senators. So we're going to keep applying that force. I try not to predict things because, unfortunately, those predictions often go so wrong. But I'm really hopeful that some of those Republicans and certainly the Democrats will, vote on the side of science and truth, and not give us this person. I just think we all deserve better. I think the people of this country deserve better, and I'm very hopeful. I guess I'll wait with you to see what actually happens. But yes, I think there's a good chance that this person doesn't get through.
Well, Rob Davidson, thanks so much for taking some time out of your busy day, I'm sure, to talk with us and express your point of view. And thanks to you and your wife for all you do for your patients. I have so much respect for doctors and scientists, and I really appreciate you. So thank you very, very much.
Thank you. And she doesn't like being on camera, but she's the smarter of the two doctors, Davidson, in her household. And as a family doctor, my hat's off to all those primary care docs out there. They're the lifesavers. So thank you again. I really appreciate the time.
Okay, very nice to
You
meet you.
too.
Thanks, Robin. Thanks, everyone, for watching. Bye.
Bye.